Grand River Hospital, one of the biggest medical facilities in the Kitchener area, had an unsettling incident on December 19, 2022. According to the Special Investigations Unit, SIU, a suspect wanted in a theft was attempting to flee when they were hit by the responders. The police officer behind the wheel was cleared of fault, but the suspect ended up with 5 broken ribs and a punctured lung. This story begins and police were alerted to a theft in progress near King Street in downtown Kitchener. When police spotted the suspect, the perpetrator attempted to flee on a bicycle, but ended up being blocked by a second cruiser. However, the cruiser lost control on a patch of ice, and the suspect was struck by the vehicle. Immediately after the incident, the suspect was taken to the Grand River Hospital for examination and treatment, but was later discharged without any serious injuries diagnosed. 4 days later, the man returned to the hospital with chest pains and was turned away, proving that it was a serious injury. He then went to Cambridge Memorial Hospital where he was diagnosed with 5 fractured ribs, a collapsed lung, and internal bleeding. After being treated for several days at the Cambridge Hospital, the suspect was eventually released. SIU Director Tony Martino determined that the officers acted within reason, and the case was closed. Grand River Hospital was unable to comment on the specific incident due to patient privacy, but they said generally speaking, anyone who comes to the emergency room is registered and triaged and seen by a physician or nurse practitioner, unless they choose to leave first. Ultimately, this is a reminder to take precaution and be careful when driving on icy roads. Even with the slightest of mistakes, serious implications may result. This incident should also serve as a wake-up call to medical establishments to properly assess patients and care for their injuries, however minor or severe they may be. The staff should always err on the side of caution, and thoroughly examine each patient regardless.